Try. I don't know. I'll say whatever.
Welcome to the exciting realm of nuclear medicine, where science meets innovation in the world of healthcare, by Natasha Hughes
And Melissa Cuevas. And we are in Math for Clinical Calculations on the nursing track.
Today we will be discussing what nuclear medicine is and what sets it apart from other imaging, the types of nuclear imaging and therapy, and also explaining, perhaps, some dosage calculations, ending with some pros and cons. What are your thoughts of the use of radioactive substances inside the body? Nuclear medicine is a branch of radiology like X-rays, CAT scans, MRIs, ultrasounds, and the list goes on. Nuclear medicine uses tiny amounts of radioactive substances to examine organ functioning or structure. By detecting the radiation being emitted by these substances, healthcare providers can diagnose conditions like tumors or infections. Other methodologies are looking at the anatomy of the body, while nuclear medicine is looking at the physiology, how that organ is working. Tiny amounts of radioactive material called radiopharmaceuticals are introduced into the body, typically through IV, but can also be inhaled or injected. With special imaging techniques, radiation is detected from inside, creating a unique image unlike that of an X-ray or an MRI. These radiopharmaceuticals have a very short shelf life in the body and dissolve in a matter of hours or become no longer radioactive. And then the body will expel them. These substances are attracted to specific organs and bones or tissues. A poorly functioning organ will emit a different signal than a healthy one. Now, do you see potential benefits in using radioactive substances inside the body? Let's explore what other benefits could be gained. It can help diagnose diseases sooner than other imaging, like cancer, heart conditions, and neurological disorders. It can also add precise treatments for conditions, again, like brain tumors, but also thyroid disorders and pain management from bone cancers. Some people are alarmed when they hear radioactive, but nuclear medicine procedures are among the safest. The amount of radiation received is similar to that of an X-ray or an MRI. It is non-invasive. Patients experience minimal discomfort during procedures. Its accurate precision can offer pre-treatment planning sooner than traditional imaging. Its constant advancements are about improving lives through innovation and precision. The two most common imaging are PET and SPECT. SPECT is single photon emission computed tomography. It involves the use of a gamma camera to detect gamma rays emitted by a radioactive tracer injected into the body. It provides 3D images of internal organs and their functioning. PET is short for positron emission tomography. This imaging involves the injection of a radio tracer labeled with positron emitting isotopes, most commonly fluorine-18. PET scans can also provide detailed images of organs as well as tissues. Radiopharmaceutical therapy involves the administration of radioactive materials for therapy for things like cancer. Fluorine-18 is one of the radioactive nuclides utilized in PET scans. It is the positron-emitting isotope. Some uses of math in nuclear medicine would include nuclide uptake formulas, ratios for proportions, solving during proportions, dosing formulas, radioactive decay equations, but most commonly formula and dosage calculations. As with any medicine, dosage calculations are extremely important. Here we can see how to calculate for nuclear medicine. And here are some calculation examples. A dose for a patient at 8 a.m. would get 818 MBQ divided by 506 MBQs per milliliter, which will give us 1.62 milliliters, and so on. As with any and all medications, dosage calculations for pediatrics takes special consideration and is still being heavily researched.
So how do you become a nuclear medicine technologist? Nuclear medicine technologists typically need an associate's degree in nuclear medicine technology to enter the occupation. High school students interested in nuclear medicine technology should take courses in math and sciences, including biology, chemistry, anatomy, and physics. Are there any concerns or misconceptions you have about nuclear medicine? So one of the biggest misconceptions is that nuclear medicine procedures expose high levels of radiation to patients. So let's talk about that in our pros and cons section. So in this pros and cons section, we're gonna explore all the things that nuclear medicine can do for you and what can be harmful. So, nuclear medicine plays a crucial role in early disease detection. It can detect a disease even before symptoms appear. So, earlier diagnosis and intervention equals potentially improving treatment outcomes. Nuclear medicine procedures are generally non-invasive and minimally invasive, meaning it involves the administration of radioactive and radiopharmaceuticals through injection, ingestion, or inhalation. This reduces the need for surgery. Nuclear medicine techniques have been shown to be highly accurate in the detection and staging of various cancers, evaluation and neurological disorders, and diagnosis of thyroid diseases. The combination of sensitivity to physiological processes, targeted radio tracers, and molecular imaging is what makes nuclear medicine highly accurate in diagnosing and monitoring a wide range of diseases. So let's look at some cons that we have about nuclear medicine. One concern is that a patient can be exposed to radiation at dangerously high levels. In reality, doses are typically low and are carefully controlled to minimize risk. But one of those risks can be that if exposed repeatedly over time, may slightly increase the risk of cancer. Example, cancer of the blood. So, patients may experience symptoms such as difficulty breathing, nausea, vomiting, and hair loss due to nuclear medicine therapy like chemotherapy. And certain medications may interfere with nuclear medicine procedures or affect the results. Another misconception is that patients become radioactive after undergoing procedures. While patients do receive a radioactive tracer, it usually clears from the body very quickly, and the amount of radiation emitted is usually not significant to pose a risk to others. So in conclusion, overall the risks associated with nuclear medicine procedures are low, and healthcare providers take precautions to minimize them, so it is generally safe. Nuclear medicine provides a unique perspective on disease and it plays a crucial role in both diagnosis and treatment. It is an invaluable tool for early detection, accurate diagnosis, and personalized treatment planning. In the world of healthcare, nuclear medicine shines bright as a beacon of hope and healing.